Hi, everyone, and welcome to the Private Practice with Soul podcast. This is the first podcast for counsellors that just don't align with the traditional approaches to business and that want to use their spiritual gifts, talents, and interests to create, you guessed it, a private practice with soul. So, look, leave it to me to provide you with everything you need, including strategies that you can use to increase your income, reduce your workload, and of course, increase inquiries and referrals to your beautiful soul-led private practice. I love it so much. If you haven't done it already, grab your journal, grab your pen, and let's begin. Lovely therapists, welcome to another episode of the Private Practice with Soul podcast. I'm so pleased that you're here today. We are going to be talking about Medicare, and the reason for that is because, as you're probably very well aware, with the next 24 months, the development of national standards for counsellors in Australia is sort of all geared toward getting counsellors onto Medicare. And so I thought it might be helpful to, be totally transparent and honest with you about what Medicare is and what it isn't, because there's a lot of misconceptions in our community, and I just want to make sure we're all on the same page about this. So I'm bringing to this conversation my experience of 20 plus years working in Medicare and working privately as well without rebates. And this is hopefully going to be a very informative session for you. So if you don't have it already, you might like to go and get your Private Practice with Soul podcast journal and a pen. And we're just going to get started. So the way that I'm going to approach this today is I want to explain, the basics of Medicare and go over that for you. And then I want to talk to you about counsellors now, whether or not they should be or should not be accepting mental health care plans, because this is also an issue that people are discussing in our community. So I want to give you some information about that as well. So I'm just going to start with what it is, and then I'll move into my experience of it as a practitioner, and then we'll go into, things to just be aware of as a counsellor. So first off, what is it? So look, it's called Better Access, for short, Better Access to Psychologists and Psychiatrists. But anyway, it's a scheme that the government put in place, I want to say, maybe it would be about 18 years ago now. I remember when I first started working as a psychologist, it had only just come in. Prior to that, psychologists were private fee paying. They weren't on Medicare. They were on other things though, like WorkSafe and victims of crime and things like that. But it took the Australian Psychological Society a long time to really advocate for psychologists and get them onto Medicare. So when did I first start practicing? 97 maybe, or 95, no, 97, yeah. So around, say, 1995, I think, was when Medicare was first introduced. So I'd have to check for you for psychologists. So it's really not that long in the grand scheme of things, about 20 odd years. And since then, it has gone through some changes. Like when it first came out, we were able to see people 18 times a year. So Medicare works to calendar years, and a calendar year is the 1st of January to the 31st of December. And so we were able to see people 18 times, and that person could get a rebate. So a rebate only applies, a rebate is money back, right? A rebate means money back. Now, if you were delivering services under Medicare and you were not charging your client a gap fee, right, and the client was receiving a service totally free for them, then you got the rebate, right, which back then was like $70. Now it's about $89. It's $88 or $89 for a psychologist. So what was I going to say? I'm just losing my train of thought again here. So you would get that money, and you used to have to process that rebate, and we do it through Huluxy. It's just, you can process it automatically through Huluxy, and you get that $89. Now, it's not great money, is it? And that's for psychologists that have masters and PhDs. It's not for psychologists with diplomas and grad dips and stuff like that, bachelors. So it's like EAP money. maybe even less than EAP money. So, maybe don't get too excited about that. The other thing, though, the benefit of it, though, for clients is that if you're going to just charge your normal rate, which should be, hopefully you are charging $150. If not, let's have a conversation about that privately because you need to be charging your worth. If you want to be seen as professional, you need to be charging as a professional, and it's not about your worth as a person. It's about the worth of your service, and you all provide valuable services. But anyway, let's say you're charging the $150 as a counsellor. If you were on Medicare and you charged your $150 and the client paid you that $150, the client would then get 90 back, 89 or 90 back, right? So that's the benefit to the client. So the client's still out of pocket, $60 or whatever it is, but they're getting some money back. And that's how it works. And they get that money back every time you deliver a service. Now, if you have a cancellation, the client doesn't get a rebate because you did not deliver a service. So depending on your cancellation fees, which hopefully are 100%, another conversation we can have because there is context around that, of course, but hopefully they're 100%. Your client needs to understand, and it needs to be in your terms or in your consent form or your onboarding, your intake, whatever it is. They need to understand that they don't get any money back for appointments that they haven't attended. So you need to make sure, there's just a little bit of admin stuff there. But anyway, this is how it works. And now it's not 18 sessions. Now it's 10. It's dropped back to 10. So there were extensions through COVID. Those extensions are no longer in place. Now it's back to 10 sessions. So they can have 10 sessions between the 1st of January and the 31st of December. Okay. If they don't use all of those 10 sessions, they do carry over, the unused ones do carry over into the next calendar year. And a referral you need to have a referral from a GP. And I'm going to go into that in a moment. It needs to have a whole bunch of stuff on it. And that referral letter doesn't expire either, okay? So anyway, there are different item numbers. So when you want to work on Medicare, you have to apply for a provider number, and you need to have a provider number for each location that you work at. So working from home, even if it's online, is considered a location. And then if you go and work at therapy rooms somewhere else, that's considered another location. So you have a provider number for each different place where you work from. And you also have a different item number for the different types of services that you provide. So you will be given a list of these, and you can Google them at the moment. I mean, you're not on Medicare yet if you're a counsellor, but you can certainly go and have a look at what the current ones are. But it's like short consults, long consults. So they all have different item numbers, okay? And your practice management software, so I just refer to Haloxy because it's what I use, but there's Power Diary and Clinico, all those sorts of ones. I don't know if Sploce uses Medicare numbers yet. They probably wouldn't if they're not working with practitioners that are on Medicare. I don't know, I haven't checked, but the numbers will automatically be populated in there for you, so you won't have to worry about that. But each service, it's kind of like when you work with NDIS, how you've got item numbers. It's the same with Medicare, so you can think of it like that. Okay, so I'm just going to read the description for a session here. Let me go back. No. Okay, so a session here, I've just got group. No. Oh, yeah. Okay. The better access to psychiatrists, psychologists, and general practitioners through the Medicare benefits schedule commenced on the 1st of November 2006. Under this, MBIS item numbers were provided for the following things: psychological therapy, which is provided by clinical psychologists, and focused psychological strategies, allied mental health, provided by psychologists, OTs, and social workers. Okay. There are 24 items for the provision of individual psychological strategies, focused psychological strategies. that are delivered by a psychologist, for delivery via video conference and phone by a psychologist, by an OT, by phone and video by an OT, and by a social worker, and by phone and video by a social worker. All right, so make up the 24. Okay. Referrals. Services provided under focused psychological strategies don't attract a rebate for your clients unless the referral was made by a doctor or a medical practitioner who's managing the patient under a GP mental health treatment plan. A referral has been made by a medical practitioner who's managing the patient under a referred psychiatrist assessment and management plan, or the referral was made by a psychiatrist or a pediatrician. Now, Medicare rebates are available for 10 individual mental health services in a calendar year. The services may consist of GP or medical practitioner focused psychological strategy services and or psychological therapy services delivered by ClinPsychs and or focused psychological strategies delivered by everyone else, so psychologists, OTs and social workers. Patients can also get an extra 10 claims per year for group therapy. So thinking about your business model, over the next, say, 5 years, counsellors, you might want to start thinking about running or planning or preparing for the delivery of group programs. It's another idea for you. Okay. Where the patient has already received the maximum number of services under that referral per calendar year, they may be eligible for primary health networks, PHNs, funded psychological therapies if they meet the relevant eligibility criteria. So there are PHNs sort of around the country. You can find out if you have a PHN in your area and the details for it just with a quick Google search. So service and length type is services provided must meet the time period of the item number. So if you're using an item number for a short session, so a short session just means a minimum of 20 minutes. A long session means a minimum of 50 minutes. Okay. And you're only allowed to use the following interventions. So psychoeducation, including motivational interviewing, that's the first one. The second one is CBT. The third one is relaxation strategies. You can use progressive muscle relaxation and controlled breathing there. The next one is skills training. So problem solving, anger management, social skills training, communication training, stress management, and parent management training. Or you could deliver interpersonal therapy, especially for depression. Or you could deliver narrative therapy for Aboriginal and Torres Strait Islander people. Or you could do EMDR if you're an EMDR practitioner. So you will note there's no PCT, there's no art therapy, there's a whole bunch of things that as a counsellor you may be delivering and working with primarily in your practice now that if you wanted to work under Medicare you wouldn't be able to deliver. If you were charging your client and the client was getting a Medicare rebate and you were using a service that wasn't one of those ones I just mentioned, you'd be committing fraud and you'd get into big trouble for that. So just bear in mind that there are restrictions around the types of interventions that you'll be allowed to use. So if you do want to work under Medicare and you don't have training yet in CBT, you would need to go and get training in CBT if you're going to use that intervention. If you don't have training yet in progressive muscle relaxation or controlled breathing for teaching people about relaxation, now might be a good time to put it on your PD calendar to do this training over the next 24 months. If you want to do skills training with clients that are referred under a mental health care plan, like problem solving, anger management, social skills, communication training, stress management, and parent management training, again, pop them on your PD planner so that you can make sure that if you end up on Medicare, you're ready and you can go and apply for your provider number and you're good to go. And same with EMDR, right? So course of treatment and reporting back to the referring medical practitioner, your client can have 10 sessions with you in a calendar year. So they might have, I don't know, however you want to do it. You could say monthly, maybe they're going to come monthly, whatever. But when this, within this maximum service allocation, you can provide one or more courses of treatment, and this enables the referring medical practitioner to consider a report from you on the services that you've provided and the need for further treatment. So, on completion of the initial course of treatment, you must provide a written report that you will not get paid for and you cannot charge a client for. You've got to do it in your own time. On completion of that report, that report needs to include information on what assessments you carried out. So if you're not proficient with doing assessments as a counsellor, you're going to need to do training on assessments. P.S. If you're an educator here, can you hear all the opportunities for you now? Like to set up some training courses and some training programs. You also need to provide information on what treatment you've provided. So it doesn't say counselling, it's the treatment. And you need to provide recommendations on future management of that person's disorder, right? So usually what happens is we're talking about, you hear the information here talk about courses of treatment. So what usually happens is the client doesn't automatically get 10 sessions. They may be automatically eligible for 10 sessions. However, you would normally see them for 6 sessions. So you're going to get a referral letter from the doctor. On that referral letter, the doctor will tell you how many times you can see the client. The doctor will usually put 5 or 6. And then they're going to need a report from you. Again, that I mentioned, you don't get paid for doing that report, but you've got to do that. And if you think that the client needs the additional 4 sessions that they may be entitled to, you need to make a recommendation in that report. And then you can't see the client. Well, you can, but you can't use a Medicare rebate with the client again until the doctor sends you another letter which says, okay, you've got approval to go ahead and use Medicare for the remaining 4 sessions. And then when you've completed those 4 sessions, you have to send another unpaid report to the doctor. Now, the reason I'm saying it's unpaid is because I want you to understand when you're doing counselling and you're not on Medicare, you can charge for everything. You can charge for your phone consultations with doctor or any other involved practitioners. You can charge for emails, you can charge for letter writing, you can charge for reports. But when we're working with Medicare, you can't pass that charge on to the client either. So I just want you to be aware of that. It is admin heavy, Medicare. What else do I want to share with you here? I'm just doing a quick scan of the Medicare website and pulling out the salient points for you. Right, now this is really important. Checking your client's eligibility. So on Medicare, it's your responsibility as the recipient of a referral on a mental health care plan to check that the client that you're working with is actually eligible. Now, I know it kind of sounds like, well, shouldn't the doctor have done that? And maybe we should make the clients responsible for that and things like that. But I think at the end of the day, it's your responsibility. But it's saying here, if there's any doubt about a patient's eligibility, Medicare can confirm whether a GP mental health treatment plan or a psychiatrist assessment and management plan is in place and claimed, or an eligible psychiatric or pediatric service is being claimed, as well as the number of any allied mental health services already claimed by the patient during that calendar year. Now, this is so important because I remember when I was working under Medicare, I had a room, as you know the story, I was renting rooms in big bulk billing practices. And you never knew who was going to show up on the day. And there were instances there where I was delivering services to clients and the medical centre were doing the billing, and they would pay me, and they would, on my pay, they would deduct 30% for the rent of the room. And then they would just give me the balance. But I never knew who I'd been paid to see and who I hadn't been paid to see. And there was one time, and I never thought to ask, right? I just trusted that I was getting paid for everything and everyone. Turns out, no, I wasn't. and it caused big problems. I was underpaid $18,000 at one place, which is why I left that place. And that's all my own fault because I never asked for a breakdown of, these are the clients that I saw last week. These are their names. Who did we get the rebates for? Who didn't we get the rebates for? That was my error. And I'm sharing it with you now so that you know, please, if you are going to work under Medicare and the medical centre is going to do the billing for you, which they will usually, and they're just going to pay you a lump sum each week less your rent, please, please, please ask them for, it's called a batch summary. Ask them for the batch summary so that you can see for yourself who you've been paid for. As I said, I never did that. I just trusted, I don't know, sometimes I'm a bit naive and I like to see the good in everything and everyone, and I live in my own sort of world where everything's nice and beautiful and blah, blah, blah. And I never, anyway, you know what I'm trying to say. But what ended up happening was there were many instances where doctors had given me referrals to see people, but those people had already had multiple sessions of counselling with somebody else. And so they'd exhausted their rebates, and it meant I never got paid. I did a whole bunch of work with clients and I never got paid. And I did do things like I would say to the client, have you seen a psychologist this year? Or have you seen an OT or a social worker this year on a mental health care plan? And the clients would say no, like that. And they'd sign a piece of paper to say no. And I would just believe that. I never thought to check because do you know what? If you're going to check every single new referral, you're going to be on the phone to Medicare a lot, and there's more unpaid time and stress, and it's taking away time where you could be on the couch with a client. So anyway, it's really important that you understand whether or not somebody's got sessions still available. So they get 10 rebates a year. Find out. You're going to have to do the work. If you have a virtual admin, like I used to use One Point Connect. I think they're based in Brisbane. They were amazing, but they can, if you can get reception, or you can get your admin person, even if they're virtual, you can get them to ring Medicare on your behalf, as a proxy for your practice, and find out as new referrals come in, does Joe Blow have a treatment plan in place, yes or no? And if so, how many claims has Joe Blow already made this year? So Joe Blow might come in for the sessions thinking that he's going to get 10 sessions, but if he's already claimed 6, he's only going to get 4 with you. Or if he's already had 3 with a psychologist, didn't like that psychologist, now is coming to you, he's only got 7 left, right? You need to know that. And it also means too, just an aside, I would recommend you update your consent form to say in situations where you have exceeded your rebates, I was going to say rebatable sessions, where you've exceeded your annual rebates under Medicare, better access with your treatment plan, you agree to pay privately, right? Or whatever, but have a line on there to cover yourself. Yeah, so there's numbers. If you need to find out the eligibility, and maybe you're a psychologist, a social worker, or an OT listening to this now, but the phone number is 132 150 to check the information. You can call 132 150. That's the number for providers. Or if you want your client to do the heavy lifting, which I don't recommend, you can give them this number, 132 011. 132 011. Okay. The patient won't be eligible if they've not been properly referred and a relevant Medicare service provided to them. So this is really important. So if they haven't been appropriately referred, I'm going to talk with you about referrals in a moment. But the second part of that, and a relevant Medicare service has not been provided to them, that means if you get audited by Medicare and Medicare learn that you provided a service that was not included in the ones we spoke about previously, you will be responsible for repaying to Medicare all of the rebates that client had with you in that calendar year. So it doesn't matter if maybe it was you did, I'm saying play therapy or art therapy, I'm just pulling them out of the air, right? But anything that's not on that list. But even if you saw the client 10 times and it was one occasion you used play therapy or art therapy, for example, it's not that you're going to have to repay Medicare the rebate for that one session. You're going to have to do it for all 10 sessions. Okay, that's the rules. And I know this because even though I'm not a psychologist now, I still provide Medicare audit support to psychologists, social workers, and OTs. And we go through this whole process. And the last audit support that I provided was about 6 weeks ago. And so I am across this. You have to repay not just for the session you stuffed up, but for all the sessions that there was a rebate provided. And you cannot then go back and say to the client, oh, hey, Medicare told me that I had to repay them all the rebates because I made a mistake in how I was treating you. So I'm just going to give you the bill for that. You're not allowed to do that either. Not ethical. Can't do that. So you lose that money. All right. It's important that you know this. Okay. Now I'm just reading something here. It says a focused psychological strategy items do not apply for services that are provided by any other Commonwealth or state-funded service or provided to a patient of a hospital. Good to know. Private health insurance. Right? This is important too, because when a client comes to you and they say, oh, okay, the fee's $150 and I'm going to get, $89 or $90 back from Medicare. Amazing. Can I get the other $50 or $60 back from my private health insurance? This is what you need to know. The answer is no. Patients need to decide if they're going to use their Medicare or their private health insurance to pay for the services. They can't use both for that session. Okay, important for you to know. Okay, so now I want to speak with you about referrals because this is where so many psychologists, so it's mostly psychologists and social workers, accredited mental health social workers, that I support with these Medicare audits, right? And it's the referrals that trip most of them up. And so this is really, really, really important. The referrals for your client must be for focused psychological strategies, right? Now, the referral doesn't need to be on a specific form. It can be a letter from the doctor. And the letter from the doctor is going to be signed and dated by the doctor, and it must include the patient's name, their date of birth and their address, their symptoms or a diagnosis, and a statement of whether a mental health treatment plan has been prepared. It needs to include a list of their current medications, the number of sessions that the patient is being referred for. So this is the course of treatment that we were talking about before. You're not automatically going to get 10 sessions. You're going to get maybe 4, 5, or 6, and then there's going to be a review. You're going to get another letter back from the doctor that says, yes, you can have the balance or not. And it must include a statement about whether the patient has a mental health treatment plan or a psychiatrist assessment and management plan in place. Okay. So the referral needs to include all of those details. Here's the thing. A lot of the time, and no, I'm not being disrespectful, but this is the reality. A lot of the time, for me, when I was working in a bulk billing medical centre, doctors are lazy, or lazy or busy, or I don't know, but the referrals come through and they're incomplete. And unless you've been audited, you might not be aware of how incomplete they are. And this is a problem because if you've delivered a service on an incomplete referral, you are then required to repay Medicare for every session that you provided to that patient under a referral, because that referral isn't valid. Okay, so it's very important that you know exactly what needs to be included on that referral letter. Now, with a lot of the audit support that I provide for people, I say that the GP referral is so important because sometimes it's not dated. Sometimes the doctor's just printed it off and whacked it in the in tray. They haven't signed it. It needs to have that signature on it. They haven't said whether there's a diagnosis or not. They haven't said whether there's the medications or not. They haven't said how many sessions are required. They haven't said whether or not they've put a treatment plan in place. And what happens is if one of those things is missing off the referral, it's not the doctor that gets in trouble, all right? It's not the doctor that's got to pay back the money. It's you. You are the one that has to pay back all that money, okay? Because you didn't check. That's your responsibility. So what I would suggest is you maybe make yourself a little checklist here so that as referrals come through, you can make sure that they meet the requirements for a Medicare audit. If you're going to get audited. Audits happen, all right, and they happen a lot. They happen at random for all different reasons. It doesn't matter how much you charge. It doesn't matter where you're located. It doesn't matter how many clients you see. Audits happen, and they can be very, very stressful, and they can cause a lot of anxiety. And so I want to make sure that you're aware going into Medicare, if that's where this is all going, that you have all this information ahead so you can be really prepared, so it can be smooth sailing for you as you make your entrance into this space, okay? Now, you need to keep a copy of that referral on file. It usually comes to you as a letter or a piece of paper. Usually the client will bring it along with them in their first session. I think that's a mistake because it doesn't give you time to verify everything. If a client brings that letter along on their first appointment, and this was a mistake I made, I just used to let clients bring it to the first appointment, but it meant that I too didn't give myself enough time to ring Medicare and check that they were eligible, to check that the referral was written up properly, or all those sorts of things, right? So please encourage your admin or yourself, if you're doing your own admin, to get a copy of that referral ahead of the appointment so that you can make sure you've dotted your I's and crossed your T's. Now, also, the referring practitioner decides how many sessions the patient's going to get in a course of treatment, okay? Not you. The maximum session limit, right? So the initial course of treatment is a maximum of 6 sessions. So as I said, some doctors will say, I'll give you 4 sessions initially, I'll give you 5, or they'll just give you the 6 straight out. Okay, a subsequent course of treatment is a maximum of 6 sessions up to the patient's cap of 10 sessions. For example, if the patient got 6 sessions in their initial course of treatment, then they can only get 4 in a subsequent. All right. The written report provided by you following the course of treatment will be considered by the doctor in assessing that client's need for further sessions after each course of treatment. Now, this is important to understand because maybe, as you know, 6 sessions, it's nothing. Like, we want to be able to, create lasting change for clients. And when we're working with clients in such a short space of time, it can be really difficult to achieve lasting change. In fact, you can go and have a look again. It's on the ABS. It's the Australian Bureau of Statistics. There's a lot of data there about the number of times people keep going back for mental health treatment plans. And part of the thinking around that is because 6 to 10 sessions isn't long enough to fix, in inverted commas, cure, solve a problem. And people are reluctant to come back if they've got to pay a full amount out of pocket because they're used to only paying the $50 or $60 now, right? So they hold off on getting the help that they need, and they carry over until the 1st of January the next year, and they say, I'm back, and you've got to start again. So there is a high level of return for clients on mental health care treatment plans, okay? And just something for you to know. Okay. What else? I'm just doing a quick check here. Continuing professional development for OTs and social workers. So if you're an OT or social worker, you're required to complete 10 hours of focused psychological strategies, CPD, annually. So that's important to know as well. It doesn't say anything there for psychs on this page that I'm looking at. So a few important things for you to be aware of. Like, can you see there are advantages for clients on accessing Medicare because it's going to be more affordable for them. However, it can also be quite limiting. If you've got a client who may not be a good match for CBT, or who may not be a good match for EMDR, or who may not be a good match for, they don't need anger management, or they don't need social skills training, they need something else, you can't provide it under Medicare unless it's one of those pre-approved interventions. So you can see it's quite limiting there. And for you as a counsellor, it puts you in a bit of a position because you really want to do the right thing, in inverted commas. You really want to make sure your client's not out of pocket, but you're not going to be able to give them the help that you might feel is going to be the right help for that person or the right match for that person and get the Medicare rebate for them, okay? Sorry, I can hear a neighbour is just getting out a whippersnipper or a chainsaw, so I might wrap this up quickly, but I just wanted you to be aware of that. And it's really important because as a counsellor, you have total freedom and you can use eclectic approaches and you can draw upon the different types of tools and techniques and interventions and therapeutic modalities that are going to be the right match for a client. That client's not going to get a rebate, but they're going to get perhaps the real help that they really need. And I think there isn't data available on this, but I feel like when clients, or it's my belief that when clients are getting the right help for them, that they probably won't come back because they probably will be able to work through an issue or get whatever it is that they're needing, be able to solve that problem or get the understanding and the clarity and move forward, get the help that they need and move forward. One of the reasons, as you know, that I released my registration as a psychologist was because I did move more into the esoteric. I did move more into wanting to work with the soul blueprint. Transpersonal stuff isn't covered on Medicare. And that was my thing. Like I'm really into Jungian stuff. I really love archetypes. I really love soul psychology. I really love all of that. But for me, working under Medicare, I wasn't allowed to provide services like that. I was getting clients coming along saying they wanted that, and I would have loved to have done it, but I couldn't deliver it because it wasn't approved, and so you may find that you wind up in that dilemma too. And if that happens, then I think you want to look at developing a model of practice that allows you to still do your private sessions like you're doing now, but be really clear for people who want rebates that they're not going to be able to access the services that they would normally get, right? Things that they're going to get on rebates as listed by Medicare are psychoeducation, so telling them about what anxiety and depression, all that is. CBT, including behaviour modification, exposure techniques and activity scheduling, cognitive therapy, progressive muscle relaxation and controlled breathing, and skills training, problem solving, anger management, social skills training, communication training, stress management, parent management, narrative therapy for Aboriginal and Torres Strait Islander people, and EMDR. Right? So just be really clear. If it does come to the point where we're on Medicare, be really clear on your counselling website what they can get under rebatable sessions, and also what they can get with seeing you without rebates, and let your clients choose what's going to sit best for them in consultation with their doctor, and yourself, of course. So really important there. Now, another thing that's come up, and it came up again today in the counselling community, and it was, can counsellors accept a mental health care plan? The answer is no. No, 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 no. And the reason for that is because a mental health care plan, as you can see here, requires that there's been an assessment made by the doctor, that there's been a diagnosis made by the doctor, that there's a list of medications, that there's, a course of treatment recommended or required or requested by the doctor, that the doctor's made a decision that this person is going to need, and the doctor will list this usually on the referral. The doctor will tell you what the client needs. The doctor will say the client needs psychoeducation or CBT or relaxation strategies or skills training or EMDR, for example. Now, that's not counselling. Even ACA and PACFA both agree that these psychological services here are not counselling. So for a counsellor to say to a client, yes, I accept a mental health care plan, but you can't get a rebate, is misleading. It's misleading to the client. The client believes that they're going to get what's on that referral. They're not there for counselling. They're there for short, sharp treatment interventions listed on that plan. Also, it's misleading because the doctor has determined that it's a psychologist or an accredited mental health social worker or an OT that is best positioned to support this client given this client's history, which you're not aware of, given this client's background, given this client's needs, etc., etc., etc. And so by you saying, yes, I accept the plan, but I can't do the rebate, again, it's misleading because a client's believing that they're getting the right help and they're not. You provide a different service, and you could leave yourself open to being reported to places like HCCC, for example, for misleading a client. Now, part of the reason that we're going to be moving into national standards is because under Medicare, and it's not only Medicare, but under lots of different things, funding things, a big push is happening and has been happening to protect the public from dangerous practitioners or practitioners behaving dangerously. And that means practitioners that are providing false and misleading information, practitioners that are operating outside of their scope of training and expertise, all those kinds of things. So for you to say, yes, I'll accept your mental health care plan, and if that plan, for example, says cognitive behavioural therapy is what's required, and you don't have a certificate or a diploma or PD in behaviour mod or exposure techniques or activity scheduling, again, we've got a case here of being misleading, operating outside of your scope of competence or expertise. And again, it may be perceived as fraudulent and can be reportable. So save yourself the headache and simply say to a client, I do not provide services under a mental health care plan. I'm a private counsellor. I do not provide behaviour modification or exposure techniques. I do not provide social skills training or, anger management training, etc., etc. But I do, as a counsellor, here is how I can help you if you have this problem. And here is how we can work together. But this mental health care plan is from your doctor, and it's requiring that you do go and see a psychologist or a social worker or an OT. You have to be clear. You have to be ethical. It is not ethical to say to somebody you're going to accept a mental health care plan. It doesn't work. Save yourself potential trouble down the track. Do the right thing. Build up your reputation for being clear and working in integrity, Another thing that you can do is you can say to that client who's made the inquiry, maybe they're there with you in person or whatever, you can say, if you like, I'd be happy to give you some information that you could take to your doctor, and if you're about how I can support you. And you can have a conversation with your doctor about that. If you like, I'm happy to contact your doctor and let your doctor know how I can help you. So 2 different pathways there for you to educate the doctor about when it will be in the client's best interest to refer to you, to work with you, sorry. Okay, so there are some things that you need to be aware of. The other thing that I would recommend is, 24 months it kind of sounds like, oh, it's 2 years away. But let's face it, it's going to go pretty quickly. I mean, think about what was happening in the world 24 months ago. It's going to happen pretty quickly. So what I would love for you to do is really go away and think about some of these focused psychological strategies that are on the Better Access plan at the moment, and put them in your diary. Start looking now for PD so that you're prepared and you can hit the ground running when you start. Have something in place around what to say to clients, or what you want reception to say to clients who approach you and they've got a mental health care plan. This needs to be ethical. We don't want you getting reported to anybody for saying you do one thing and you're doing something else. Counselling is not a focused psychological strategy. They are 2 different things, okay? I just want to make sure that you're doing the right thing, that you're acting in integrity for yourself and for your client. You're not putting your client at risk. If a doctor said the client needs exposure therapy and has ticked that on the referral, and you're just like, well, I'll accept the plan from you, from the doctor, but I can't do the rebate, and then you're just going to go off and do your own merry intervention. Maybe you're going to do play therapy or art therapy, and you're not going to do the exposure therapy. There again, you've left yourself open, okay, to complaints and all those sorts of things, and we don't want that happening for you, okay? So there's really a lot there to be aware of with Medicare. It is absolutely going to benefit counsellors who already work in the space of mental health, and not all counsellors work in mental health. Like, did you see here relationship therapy isn't covered, couples therapy isn't covered, relationship counselling isn't covered, couples counselling is not covered, grief and loss is not covered, bereavement is not covered, careers is not covered, there's so many, ADHD stuff is not covered. There's so many different things that you do as a counsellor that aren't covered on Medicare. So Medicare may not be appropriate for you. So is there any benefit in you being part of a membership organisation that's pushing for Medicare, and it's going to make you jump through scientific hoops and stuff like that if it's misaligned with how you practice and what you do, right? You can still work as a counsellor without having to jump through those hoops, and you'll be able to still do the work that you really want to do. So just be aware, be really aware, keep yourself informed. I noticed that ACA are saying at the moment, they're really big on only come to the ACA with your questions, don't go anywhere else, only get your answers from us. I really feel like there are so many places you can get your information from, and I disagree that you need to rely on one place only. And the reason that I say that is because of what happened with all of us psychologists with the APS. We made that mistake of only relying on our peak body to give us information, and we were grossly misled, and there was court action and, all this sort of stuff that happened as a result of that. And the stuff's still ongoing today, as I understand. Around that, we ended up with making a real mess of things because we were not informed. We solely and wholly relied on our peak body. I share this with you, not to disparage, APS or what happened, but to make you learn and not make the same mistakes that so many psychologists made of just trusting our peak body. Please be good at asking questions. Please be good at asking for more information. Please be good at researching. Don't be afraid to go onto the Medicare website and have a look and see what's included and what's not, and read up about what's a Medicare audit and what's not. There are other things with Medicare as well. It's a different demographic of client than you're used to seeing as a counsellor. Often, not all the time, but often there will be times with clients that you see on Medicare that will request reports from you, and because they're used to getting things free of charge, they're not going to want to pay for reports, and it's going to be a decision you make. Will I write this report for court or not? Will I charge for it or not? You will be asked by the community legal centre, for example, to write reports, and you may be able to charge, but it's unlikely that you're going to get paid, and you're going to feel perhaps pressured to deliver free services, and you don't have that same pressure when you're working privately as a counsellor. Okay, it's different. Client groups have different client characteristics and different client needs and different client requirements, and you need to be across those and aware of those before you start delivering services in that space. So that's why I did this episode for you today. I would really love for you to, if you do have questions about Medicare and what it's going to mean for you as a practitioner, I would love for you to email your membership body, whether it's PACFA or ACA or someone else. Contact them and ask. You've got nothing to lose and you're not going to get into any trouble, but certainly asking a question of, will I still be able to use this therapy if we're on Medicare? I think that's a really important question for you to ask, because you've built a career around your niche, or you've built a career around a particular modality that really aligns with you. And it would be a shame for you suddenly not to be able to use it, and to be now required to go and do retraining in a more scientific model that didn't align with you so that you could provide Medicare. So you're going to need to make choices over the coming years. Again, it sounds like a long time, but 24 months is going to go really quickly. But you're going to need to make some choices around the business model that you want to use. For me personally, Medicare was wonderful when I was first starting out. It did fill my diary. However, it could have very easily led to burnout, because I found that because I wasn't charging my clients, I did need to book a high volume of appointments to be able to pay myself and my overheads and stuff like that. So there was that to consider. I did want to start charging fees at one point in the medical centres, but because they were bulk billing clinics, it was like no-go, so I couldn't do that. I did have to write reports and things and stay back and do all of that unpaid. There were many times I had to go to court as an expert witness for clients, unpaid. It meant that I had to cancel. So when you go to court for a client, it's not because you're in trouble or anything like that. The reason that they ask you to go to court is to explain to the court what's happening for this client, explain to the court what the diagnosis is, how that diagnosis can impair that client's functioning, like their decision making or their relationships or their work attendance or whatever it is in the context of why they're at court, stuff like that. So you go as an expert witness, you go as a friend to the court. You're not there because you're getting in big trouble. But it does mean that on very short notice, you're going to get a phone call from the registrar or from the solicitor to say, hey, we need you in court tomorrow, or hey, we need you in court the day after tomorrow. You're then going to have to cancel all of those appointments. You're going to have to go to court. So you've missed all of that income for that day. Can't charge your client, because if they're getting bulk billed, it's probably because they don't have money to pay you. And you can't charge the lawyer because it's not the lawyer do you know what I mean? So you lose income that way. it feels nice to go and be supportive for your client, but it also feels like a lot of pressure because existing clients who have appointments booked in for that day can get grumpy because they do want to see you, and now they're put out, and if you're fully booked, they might not, your next available appointment might not be for a couple of weeks, and it's just difficult for everybody. So really think about whether or not this is a good business model for you. There may be, I'm speaking generally and from my experience, but I did not get paid one time in all the times I went to court as an expert witness. I did not get paid once. It cost me money. And there were times there where I went for the day and I was just sitting out in the foyer. I never even got called in. I was just sitting out there in my pencil skirt with my little blouse and my jacket, my little suit jacket and my little briefcase and my iPhone, and I was just scrolling through my iPhone, stressed the whole time because I was worried about people I wasn't seeing, but also because I was worried about when am I going to get called in, what are they going to ask me, stuff like that, all the things. So just be aware. I'm sure there are psychologists who did manage to get paid for going to court, and that's amazing, but it's just something I want you to know, okay? Medicare is a wonderful way to get people introduced to counselling or psychology or mental health social work. It's kind of like EAP in that, there's big concessions for them initially, but you need to learn how to convert those people to full fee paying afterwards so that they can complete a course of treatment properly and so that they can get the best from it. And so, again, that's something else for another episode, but that then comes back to, do you feel comfortable converting clients? And if you don't, well, you've got 2 years to get comfortable with that. And if you need support with that and help with that, you can come into the memberships. Just a side note, it's covered in the memberships. Plus you get coaching calls with me in the memberships where we go over this. So you've got time to learn how to convert people from free or low cost services into full fee paying. Because again, ethically, you have a responsibility and a duty of care to provide those people with a full course of treatment or therapy or counselling, depending on what lingo you want to use. And you have a responsibility to let them know right from the beginning, this is what a course of treatment looks like. We're going to start here with this free or low cost thing, and then we're going to move into this. Right? So it's about being transparent, letting the clients know this is the pathway, this is what it's going to look like, this is what's included, this is what's not included, all those kinds of things. So if you want to read more about it, you can go to www.9.health.gov.au/MBS. Also, side note, just looking, it's not a secure site. It's a government site. I mean, is it any wonder there are leaks and people, grabbing the data? I don't know. Anyway, that's that for this episode. Again, this was just an informative episode to help you be across what Medicare looks like now for psychologists. And also interesting to note is at the moment there are 2 tiers for psychologists. I've shared with you the rebate for a psychologist who's not clinical, and that is $89.65. So that's what your client would get back, $89.65. Now, if you were going to provide a service and not charge your client, you would get that $89.65. Is that $89? Well, you wouldn't even get that. This is the other thing I want to tell you. I'll share with you. There are all these tiers. Psychiatrists get a higher level, then it's GPs, because GPs can do all this work as well on a mental health care plan. They can write them out and to each other or themselves and do the counselling. And then it's ClinPsych. So ClinPsychs, I think, I can't remember and I don't have it in front of me, but I think it's like 124 or something, or 130 they get. And then all other psychs get $89.65, and then social workers, let me just see if I can see what the social workers get. I think it's $10 less. I will just see if I can find it for you. Medicare item numbers for social work. So social workers, yeah, it's $10 less. It's $79.05. So I'm guessing a counsellor is probably going to be $69.05. So it's not going to be possible for you to deliver free sessions to your clients. I mean, you can, and of course, if you have a business model where you're already profitable and you've got regular stable income coming in and the practice is established, you want to do some pro bono sessions, you can. But what you will get for those sessions is probably going to be $69.05. Now, if you're going to, so I'm getting the hiccups now. If you're going to be a fully bulk bill private practice, that's the maximum you will get per client per 50 minute plus session, right? Not much, is it? It's probably, well, about a third of what you should be getting. Anyway, or half of what you should be getting. So, yeah, about half of what you should be getting, which is not sustainable. Yeah. So even if you were charging the recommended fee, my recommended fee, which is $150, and the client was getting $69 back, the client is still going to be out of pocket. Sorry, I'm just going to bring up my calculator because I don't want to do it wrong.
It's okay.
Hey Siri, $150 minus $69.
It's $81.
So the client is still going to be paying you $81, right? They're still going to be out of pocket that $81. Just interesting to know. So anyway, I just wanted you to be aware of all of that. I hope that this was an informative session. If you have any questions about Medicare, you've got the numbers. I provided them during our conversation today. Plus, you can also go and have a look at all of this information on the website that I provided you with today as well. I think it would be a really good idea for those of you that do align with Medicare and you do want to deliver, exposure therapy and CBT and relaxation strategies and anger management and stuff. If that's what you really want to do and that's aligning for you, but you don't yet have PD in those things, I would definitely go and get them, because if and when you get audited, it's going to help you to demonstrate your scope of competence, because again, you can't be working outside of that. And same for things like, of course, EMDR. So do go, and if it does align with you, start making a plan now of what services you want to provide, like whether it's psychoeducation or motivational interviewing or any of those, and go hunting now for courses and get this PD done now so that you won't have to worry about it when the time comes. I am putting together a Medicare information pack for counsellors. So if you feel overwhelmed by all of this, please don't worry. I will make everything very simple. I will include some checklists for you so you don't have to create them. I'll put all of this information in table form and stuff like that, so it's really, really easy for you to follow. And of course, not just for counsellors, but of course, I will include like an audit information pack, which is handy to have anyway, but also relevant for psychologists and social workers and OTs. I haven't supported an OT yet through the Medicare audit process, but the process is the process. So I will also include that for you as well. I will try and get this out for you in the next week or so, so that you can grab it. I think it's going to be a really handy resource for you to have. But do keep your eye on Medicare and what's happening. please do not solely and wholly rely on your professional body for support with this. One of the other things that I can't see the ACA membership breakdown. I don't have access to the annual report because I'm not in the club, but PACFA have put their annual report online and you can go and download that and have a look. But I was looking at this morning because I wanted to look at the membership breakdown. Really interesting that, congratulations, they've got, 5,560 odd people now in their membership. Now, to me, that's a huge achievement for them and that's amazing. I'm so pleased for them. But at the same time, that's like a drop in the ocean compared to how many counsellors are actually out there. How many counsellors are operating and don't listen to this podcast, or aren't in the Counsellors Connect Australia group and don't know about all of this stuff, or aren't in ACA or PACFA because they just don't want to be? To me, it just feels like this is a drop in the ocean. But anyway, when you have a look here at the membership, you can see that of the, what have we got? Well, interesting. Of the actual individual members, it's not 5,560, it's 5,229. Of those, 74 aren't practicing, 14 are academic, 153 are affiliates, so we can count out a whole bunch there already. Then we've got students who I don't know if they're going to be practicing or not. I don't know what's going on with them. Then we've got new grads, and then we've got provisional, and then we've got clinical. So clinical, I imagine, is PACFA's like fully registered, you're good to go, you can, off your trot sort of thing. They've only got 1,619 members. Now, again, it's well done to them for getting those numbers. That's huge. It's great. I wish I had 1,619 members in my paid memberships. I don't yet. So I know the work that goes into getting that. But I guess my concern is if there's only 1,619 members that can do this work, are they really representing everybody? Do you know what I mean? And of those 1,619, how many actually want Medicare? And of those 1,619, how many actually want to be under national standards? And of those 1,619, how many want to be regulated? I don't know. It's just interesting. But I'd be really interested to know what the ACA's membership breakdown looks like. Again, these are such small numbers when you think about the counselling community in Australia, and it includes, counsellors include, I know some people in ACA and PACFA won't like this, but psychologists do counselling. Not all psychologists, but many of them do counselling. Social workers, even if they don't have the accredited mental health counsellor, there are still some social workers that are doing counselling. Pastors, so I'm talking like religious pastors here, they do counselling. Wellbeing teams at schools do counselling, but they're not likely to be in PACFA or ACA, but they're still providing counselling. So there's so many people doing counselling who may not be calling themselves counsellors or who may not be in one of these memberships or I just feel like, I don't know, I just want to make sure people are fairly represented. And this now is, while these national standards are in the throes of being developed, I think now is the time for you to raise your voice, raise your hand, ask the questions, go to Philip Armstrong, go to Joanna DeWeaver, go to whichever membership you're in and ask the questions. And you know what? You can also get under freedom of information if you are aware that you're membership body has been having meetings with government departments, you're entitled to the transcripts of those meetings, okay? Now, because I'm not in either of those groups, I don't know if they readily share. I don't know how transparent ACA and PACFA are. I don't know if they just tell you things after it's happened, or if they're just like parenting you and saying, don't worry, just sit there and, do your thing and I'll just come back to you when I've got some more information. Or if they're saying, here's what's happening. Here's a transcript of this, here's a transcript of that. What I am aware of is I was able to get a transcript from PACFA. So I think they're probably, I can't say more transparent than ACA because I can't access any of the ACA stuff. Therein again, it says a lot, doesn't it? But anybody can go onto the PACFA website and you can download some transcripts of times that they've been, like at that Mental Health and Suicide Prevention Select Committee. Like you can go and transcript that and download that transcript. So I would be requesting transcripts. The ACA recently emailed their members to say that they'd had a meeting, and PACFA were present at that meeting too. But they said that they had this meeting with the health committee. Well, ask, can we have a copy of the transcript of that meeting, please, Philip? And get yourself a copy. And if he doesn't give it to you, go to PACFA and ask. They may give it to you. It looks like they're very open to making the transcripts public. But if they don't, then you can go to the health committee and you can request under Freedom of Information a copy of that transcript. And I'm going to do that because I want to know exactly what's been said. I want to be fully informed. And it's just me, and it's just my own wounds from what happened in psychology, but I don't trust peak bodies to be open. Yes, I'm saying what happened with the APS is going to happen with ACA and PACFA. It's my own stuff I need to work through. I know that, but I would rather be fully informed than not informed. So, yeah, I'll be requesting a copy of that transcript, and when I get it, I'm happy to share it in the Counsellors Connect Australia group. But if you want a copy as well, there's nothing stopping you from just writing to the ACA or giving them a call and requesting a copy of that transcript from the meeting that they had last week. It'll be there. It'll be readily available, and they should just be able to flick it to you via email if they haven't popped it on their website. And again, as I said, if they don't give it to you, you can just ring the health committee and request a copy, and they'll certainly send it out to you. In which case, if you do get it, please read it properly. Please read it with a critical eye. Ask yourself questions like, what does this mean for me? What does this mean for my practice? What will this mean for my clients? And make notes, highlight things, make notes, ask questions. Because once this all goes through and national standards are in place, you can't undo that. There's not going to be any turning back. So get all the information you can now. Ask the questions you can now. You have a voice now. Now is the time to use it. Okay. Now, also, just before we finish up, somebody was asking me in the group today, have we heard back from Philip or Joanna yet about coming into the group to do a Q&A with our members and answer any questions? Neither of them have responded to that request, which is a little bit disappointing, isn't it? Two industry leaders declining to speak with us. Well, not declining, but not replying. So hopefully they'll get back to us in the next week or so. If not, what I will be doing is I will be collating all of the questions in our question thread, and I'll be submitting them for answer. And we're just going to take it one step at a time. If we get no answers from either side to our questions, well, I think again that should be that's a red flag, and yeah, we'll have to look at next steps from there. But hopefully we're going to see some transparency during this important time in our community. So this is your time. If it's not about being rebellious, it's not about causing trouble, it's not about anything like that. This is about you having all the information you need at your fingertips to decide whether or not you're going to continue your membership with these organisations, or if you're going to want to be with an organisation that's pushing for Medicare does align with you or not, or do you need to go somewhere else, or what national standards are going to mean for you. Okay, so yeah. If you want to discuss this further, of course, jump into the Counsellors Connect group. The group is so good at the moment. That's something else I wanted to share with you. Given the highly contentious and sensitive nature of everything that's happening in the community at the moment and the posts that I put up last week, I have been just blown away by the level of professionalism between the members of the CCA, the Counsellors Connect Australia, in terms of approaching this. I know that especially for members who have diploma qualifications, this is an especially concerning time, a worrying time. But I just want to acknowledge that everybody has just handled themselves so well. I mean, you can go back through the question and answer thread there and you can see sometimes there have been instances of people having different perspectives and different opinions, but they're discussing things nicely and with respect. And there's no more of that bullying or the negativity and that harassment and all that. That seems to have gone. And it has just opened the door to a more rich, a more valuable conversation. And remember too, in our group there, we have over 6,300 members. And in any given week, over 5,800 are active. That means that they come in and they read and they engage and they look at what's going on and stuff like that. But many of them are silent members as well. So I think it's just wonderful that we're now moving into a space where we're behaving as professionals. We can have professional type conversations, even though they may be, having a lot of potential to be emotionally charged. But we can have these conversations now, and it's going to move us forward together as a community, right? Irrespective of if you're with ACA or PACFA or ASW or not with anyone or whatever, we're all doing counselling. And many of us are counsellors. We are the counselling community, right? And we are the big voice here, not PACFA or ACA. It's the big community of counsellors. We are the voice here. And it's by us coming together and having these discussions that we get to influence what's going on. And by having these types of conversations be so respectful and be so value packed, it really helps us guide how we want things to go down the track. And you know what? It might be that, as a community, we're happy to support PACFA, or as a community, we're happy to support ACA or none or whatever. But the strength in our community and the strength in the voice that we have, okay? And I don't know, I'm even thinking as I'm sharing this with you out loud, and it's just stream of consciousness talking here, but we have more members in our group than PACFA have in theirs. And in my community, I've got more members than PACFA and ACA combined. So it may even be possible that if, as a community, we decide that we're not on board with where PACFA and ACA are going with this, maybe as a community, we write a letter to the health department, or we do our own thing and we express our own concerns and we say, hey, we don't align with either of these at the moment. We are the counsellors and this is what we propose, or this is what we suggest, or this is what we recommend. There's certainly scope for these conversations to be had now. And the reason that we're not involved in these discussions is just because it's not come up before. But we certainly can be. There's nothing stopping you from having a voice as an individual, or for us as a big community from having a voice. As an individual, the way to have a voice would be to submit in writing an email or a letter to the health committee saying, I don't align with PACFA, or I don't align with ACA and this is why, or that's why, or and putting in your suggestions. You can submit suggestions. The health committee will listen to them. The health committee will read them. The health committee will receive them and acknowledge them. And you can submit suggestions yourself as an individual counsellor, right? About your thoughts on the national standards, your concerns, your recommendations. You can do that. There is nothing to stop you from doing that. And in fact, I would encourage you to do it, because if you stay silent, it's just going to be these two that steer the ship. And then we're all just going to be dealing with whatever these two decide. These two I'm talking about, PACFA and ACA being the influential ones that are coming together here. So, yeah, I just wanted to share that with you, because I know there are some of you who are feeling powerless at the moment, but I want you to say, no, you actually have more power than you realize. And this is an opportunity for you now, especially now while this committee is getting set up and they're exploring everything. The next 2 years, do it this week. Make a note in your diary. Monday morning, I'm going to email the health committee, and I'm going to share my concerns or my recommendations or, put in my 2 cents. This is your time. You can be heard. You can have a voice. You've got a voice, and it's okay and it's safe for you to use it. All right. That's what I want you to take away from this. So I hope that this was an informative episode for you. I know it went on a little bit longer than normal, but I felt it was just really, really important to share this with you. And as I said, if you have any questions or discussion points or things you want to raise, please come into the Counsellors Connect Australia group and do that. If you're not in the Counsellors Connect Australia group yet either, I would love for you to come along and join. It's easy to find. We're just on Facebook. And yeah, keep informed. Even if you perhaps want to be in the silent audience, that's totally fine. You're welcome to not get involved in discussions. That's totally fine. But at least you can read what's going on and you can stay informed that way. Okay. So have a beautiful Sunday. Gabe and I are going to go and have lunch now. Oh, I'm so excited. Let me tell you something else just quickly. I got Gabe and I a love seat. I know I needed to replace the desk chair for my study because it's on casters and I'm on carpet and da. But anyway, and I was just like, yeah, I want to get a chair. And then I was looking at Gabe and I was just thinking how much I love him. He's my Maltese Cross. If those of you, my Maltese Cross rescue dog, he's 13 and I just love this dog to bits. And I was looking at him and he was giving me like a message. He was communicating with me telepathically, I like to think. He was like, Mum, get me a chair that I can get on too. So I was thinking, what do you call those chairs? Like, I don't want to get a sofa. I've already got a couch. Like, what's a different type of chair? And then I was like, oh, I think it's called a love seat. So I looked up love seats and now I've bought a love seat. I'm so excited because it comes in 4 days and I've got to assemble it myself, which is a little bit concerning because I'm not great with, well, I'm sure it's not flat pack. I'm sure I'm just going to have to screw in the legs. That's it. I think I can manage that. But yeah, that's going to be so cool because then when I do my videos for PP 101 and the Inner Circle and Digital Product Success Hub and all of that sort of stuff, Gabe will be able to be on the couch with me and it's going to be so great. And you'll be able to see him and he can see you. And oh my gosh, he loves watching TV. I don't know if I've shared this with you either. It cracks me up so much. Like, at night, I'll be watching TV and, my mum lives with me because I look after her, as you know. So my mum and I'll be sitting there watching MasterChef or something like that. Gabe loves MasterChef, of course, because he loves snacks. So, if my mum and I are talking and it's bothering Gabe, Gabe will get up and he'll walk from where we're sitting to over right in front of the TV and he'll make a real production of like having to move up to TV so he can focus and listen over the top of our talking. But Gabe's favourite shows, he really loves MasterChef. And he really loves anything with police in it. So he loves Line of Duty. And he really enjoyed Blacklist. And the other thing that he really enjoys, which is just so disgusting, is he really loves watching the Dallas Cowboy cheerleaders. So there's a series on that shows you about DCC and how they get all the new cheerleaders to apply, and they've all got to do their dances and everything. Oh, so gross. Gabe gets right in front of the TV and he stretches his neck forward and he's fully ogling the women. I'm like, oh my gosh, this is so embarrassing. But anyway, you'll get to see Gabe. Hopefully, he can get up on the love seat. I'll pick him up, obviously, and I'll get a little blanket because the love seat is white or cream or something, because everything in my room is white or cream because I went for a boho theme. So I've got lots of foliage and plants and things like that in here. So I'll get a little blanket to protect the thing and a cushion for his little back, and hopefully he can just have a little sleep, or he can pop up and say hello to everybody now that he knows how to watch TV. So yeah, I'm really excited to get that. Fun times ahead. One of the perks of working from home, really, isn't it? Okay, well, have a beautiful Sunday. I'll say it again, and I'll see you inside the group. Thanks for listening to another episode of the Private Practice with Soul podcast. Bye for now. I hope that you loved this episode as much as I loved putting it together for you. To get more resources to help you in your private practice, head over to Instagram. My handle is @theprivatepracticecoach. And also, if you want more inquiries and referrals for your business, let me know. I have a program called Clients on Demand that opens every quarter, and I can absolutely get you some information for that as well. You are doing an amazing job. Thank you for sharing your gifts with the world. Bye.